Why is Zoetis rushing a brand new NGF blocking drug for dogs through regulators, while quietly stalling the cat version? After Librela and Solensia harmed thousands of pets, you'd think regulators would be cautious with both. But they're not. And the contradiction exposes something deeply wrong with this entire system, the contradiction no one can explain. Something strange is happening in veterinary medicine, and the more you look at it, the less sense it makes. On one hand, regulators are fast-tracking Lenivia, a brand new NGF blocking monoclonal antibody for dogs, the same drug class as Librela. On the other hand, they're delaying Portela, the cat version, even though Solensia, the feline NGF blocker, was rushed through with barely any hesitation. Why the sudden caution? Why the selective caution? Why now? And why only for cats? Today we're going to break down the timeline, the contradictions, and the uncomfortable truth regulators don't want to talk about. The timeline that makes no sense. Solensia was approved quickly, quietly, and with almost no public scrutiny. Librela followed the same pattern. But now, suddenly, the pattern breaks. Lenivia is being pushed through at record speed. Portela is stuck in limbo. Same company, same drug class, same mechanism of action, same risks, same regulators, but two completely different levels of urgency. Why? The Librela and Solensia backlash changed everything. When Solensia and Librela were approved, regulators weren't under pressure. There were no mass reports of neurological collapse, no Facebook groups with tens of thousands of grieving owners, no petitions, no media coverage, no public scrutiny. But now, the world has changed. Owners are documenting everything. Veterinary professionals are divided. Journalists are paying attention. And Zoetis knows the reputation of NGF blockers is damaged. This is the environment Portela is walking into. And regulators know it. Why dogs get priority? Dogs represent the largest veterinary market, the highest lifetime spending, the highest insurance coverage, the most profitable OA segment. Cats, by comparison, are more sensitive, more reactive, more unpredictable, less profitable. If Lenivia succeeds, Zoetis protects billions in revenue. If Portela fails, Zoetis loses a smaller market. So they push Lenivia hard. They stall Portela quietly. This isn't about safety. It's about strategy. The uncomfortable truth about regulators. Regulators do not evaluate real-world harm. Owner reports long-term safety. The track record of the company. The track record of the drug class. They evaluate only the dossier the company submits. Short trials. Hand-picked animals. Limited follow-up. Company-funded data. So even though Librela has caused immense suffering, that does not legally affect the approval of Lenivia. The system is designed to approve, not protect. Why Portela is being delayed? Solensia exposed something regulators can't ignore anymore. Cats are more vulnerable to NGF blockade. They crash faster. They show neurological effects more dramatically. They have a narrower margin for error. If Portela launches and cats start reacting badly again, the backlash will be immediate and undeniable. Zoetis cannot survive two feline disasters, so they stall. Regulators stall. Everyone stalls, not because they're protecting cats, but because they're protecting themselves. The contradiction that exposes the system. Here's the contradiction in one sentence. If NGF blocking drugs are safe, why delay Portela? If they're dangerous, why fast-track Lenivia? Both cannot be true. and the fact that regulators are treating these two drugs so differently tells us something they won't say out loud. They know there's a problem. They just don't know how to handle it. What this means for pet owners. This contradiction matters because it exposes the lack of transparency, the lack of accountability, the lack of independent testing, the lack of long-term safety data, the influence of pharmaceutical giants, the weakness of veterinary regulation. Pet owners deserve better. Pets deserve better, and the silence around Portela is one of the strongest signals, yet that the NGF blocker narrative is cracking. The fight continues. If your pet was harmed by Librela or Solensia, you are not alone. Your story matters, and together we can force regulators to answer the questions they've been avoiding. Subscribe, share, stay loud, stay united, and stay informed.